We also believe in what we call infield observation. Infield observation is you need to know what your marketers are doing outside. So for myself, I make sure I meet up with my marketers wherever they're going. I go along with them. So maybe once every 2 weeks, I'll say, well, I'll just out of the blue, pick a day and go to them and says, where are you going today? What are your plans? Because you better have a calendar of who you're visiting today. You better have a calendar set up already, because I already will have your calendar a week ahead of time. I will also make sure who you added into your calendar on who you're going to be popping into to try to open up some sales. You better be seeing a few more people every day that you haven't seen yet. I want to be able to observe how you market yourself out there, how you speak to the physician, how you speak to the social worker. I want to see in-field training, in-field technique. I want to make sure that you are following my policy and procedures and you're following my rules. Okay? So we want to be able to see that. A lot of times owners don't have time, administrators don't have time, so a lot of the clients that we help for, they give us a call, we fly out to wherever they are, whether they're in Florida, whether they're Texas, California, here in Illinois. We have some next week that we're doing, 2 of them. And so we actually go in the field and follow their marketers for them. So we do interviews, we help you find the right marketers by interviewing them. We work with you with that. We also make sure we go in the field to make sure to give you a report. We sometimes even videotape them how they make their cold calls, because we can show them their video to see how they are marketing out there, how they're doing the cold calls, and then they can actually self-assess them. And we can also in-field assess them as well, because that's how you're going to learn. Just like in nursing, when you were a nurse, when you go, you have your clinicals. You want to be able to try it out. And at the same time as home visiting nurses, we're required to provide supervision as well. So just because we have our nurses visiting the patients, we still need to send a supervisor, making sure that they're doing what they're supposed to be doing. Well, it works the same exact way with your marketers. Somebody needs to supervise your marketers and not just trust them to go out there. You don't want your marketer to give them all the training, then all of a sudden, even just they've been there for only 1 month and they become what we call spaghetti marketers. Spaghetti marketers, meaning that all they do is walk into a doctor's office and they go up to the reception and says, hi, my name is so-and-so with this home health agency, here's our flyers, please refer to us, and leaves. Okay? You need to be able to have marketers that knows your organization, knows what you're selling, knows your policy and procedures on your marketing, and follow that.